Okay. So thank you guys for attending nucleic acid extraction webinar hosted by 3DMed. So every molecular test starts with sample preparation, nucleic acid extraction. Sample prep is the key step for molecular diagnostics, which is critical to the sensitivity and accuracy of molecular tests, and often determines the turnaround time as well. So scientists used to say garbage in and garbage out. So today we will share our progress in improving the efficiency of sample preparation and nucleic acid extraction for infectious disease testing and cancer diagnostics. So today, Scientific Fellow of 3DMed Diagnostics, Dr. Fang, will give you a presentation on nucleic acid extraction. Dr. Fang lead sample prep solution development and automation in 3DMed. So before joining 3DMed, Dr. Fang led sample prep chemistry and engineering at Thermo Fisher Scientific for more than 20 years. So he's one of the leading experts in this area. So many of the Thermo Fisher's extraction kit came out from his hand. So let's welcome Dr. Fang for the talk. So Dr. Fang, please go ahead.
Thank you, Dr. Chen, for your kind introduction. Before I start the real presentation on what we have done to improve the nucleic acids purification workflow, I want to give a simple introduction of the company I'm working with, the 3DMed. We are a diagnostic company that provides solutions in both infectious disease testing and the oncology tests. On the oncology side, we also have a clear lab. So we recently because the COVID is getting escalated in China, especially in Shanghai. So we also built a clear lab or mobile lab for the COVID detection. So a lot of our works and products, workflow and products actually get validated in our own labs. So that's why that's a key procedure for us to make sure the product works well in the customer's hands. So 3DMed is founded in 2010, and we heavily invested in R&D to develop technologies and the chemistries. So we have over 1,100 employees, and more than 300 out of this employees actually work in the R&D, is developing instruments or the chemistries, including the sample prep and detection library prep and the sequencing for sequencing. And we help the customers around the world, their work. We have right now, I think it's covering more than 60 countries with revenue more than $100 million. But just like as Dr. Chen mentioned, the workflow usually start with sample prep. The clinic species specimens can be in different forms, right? It's I think the COVID, when you have throughput, you need a lot of sample process. A lot of people realize the importance of the normal standard, either you call standardization or normalization of the initial sample format. Is use the same size tube, right? Same solutions, so you can use some sample accessioning instrument or manual process. It's easy to transfer the samples to the 96-well format. Then you do the extraction, right? So we call it sample prep. It's basically including sample accessioning, meaning like scan, register your samples, auto quality into 96-well format. Then we do DNA RNA release and purification. Then all this part in this dotted circle, that's the one I talk about, a sample prep. Then on the downstream is either you use amplification detection either by qPCR or sequencing. So we developed the whole workflows except the sequencing machine. And so the reason we do this is we want to have a better customer experience from the beginning to the end. And that's our goal to work with. Because the sample prep is like driven by the molecular test, right? Especially the infectious disease drive up really fast. You can see that sample prep actually, the need is growing rapidly. I mean, before COVID, I think it's only few percent growth. After COVID, then it's projecting growing more than 11%. I think that maybe some region may be even higher, especially the Southeast Asia countries. They previously didn't do a lot of molecular tests for infectious disease. And we'll see the Asian Pacific region will have more market shares and follow up the development in the Europe and the US. So the sample prep methodology-wise, it's just like a column-based or the magnetic bead-based purification. When I was at Summer, or before Summer, it's like applied biosystems. We focus on magnetic beads-based purification because a lot of people use QIAGEN in Europe and the US, but they are spin column-based. Then it's very difficult to automate to handle more samples, right? During COVID time, then people start even thinking about whether use just reagent-based, like saliva, directly go to extraction. But the extraction has two sense, right? It's both for purification and also, in most cases, we also do enrichment, right? For example, in our kit, we usually start with 200 microliter to 400 microliter sample, then you end it up in purified 50 microliter. So you get 4 to 8 for the concentration to increase your detection sensitivity, analytical sensitivity side. So there is a different customer ends, like hospitals, pharmaceutical, biotech, and diagnostic lab. Those are the labs we call it more to centralize the testing. That's when the high throughput need is there. So that's our main focus on the workflow is developed for those people processing a lot of samples. So I want to share with you guys how the principles I try to implement with them with a private biosystem or Thermo Fisher or 3D Met. I think a good product usually follow the similar good principles. In the molecular diagnostic side, first is fit for purpose, right? It's translated to, you have to get enough quantity, right? And purity for the detections. So the purity is key for the consistent detection. And for the quantities, make sure that you have enough the molecules get into the detection. For qPCR, typically for consistent detection, it's a few copy to 10 copy of RNA into your reaction vessel. That's why when you use like large volume, when you use large volume detection, then you can have higher, the more sensitive assays for lower detection limit, right? So because you guys large volume, then you can put more molecules in, or you can start with lower molecule per microliters starting solution, because you add more volume, you get same, you can make up the number of the molecules. But also from working with big company, and also like our 3D Med, now we make millions tests a week, you know. So when we do those scales, we not only just think about the utility, but also use not just this usability, right? That's most of people develop kits, we just think about usability. But we also think like a utility, means like your electricity supply or your water supply at home, right? That's the same, you have to be reliable. Any conditions, you should have it. So that's when we think more like manufacturability and all those things, whether we can custom support, whether we can mend this product in different automation platforms or different sample matrices, so that way you can, whatever condition comes up, you can use our solution to deal with your needs, right? Of course, the most people, like most companies do, we think about stability and user-friendly. But on top of that, I usually think more on the scalability side, because we want to make sure we support everybody who use our products. So here, just give an example, right? So, like for the COVID extraction, most people already realize use swab is a good enough sampling process, and the swab is relatively clean, and you considering comparing to other body fluids or other species specimens. So this one, and also the COVID virus, is an enveloped RNA virus. So the envelope is very easy to dissolve by harsh chemicals. So that's why we see the PK addition is very, very tedious work. So we try to remove it by improve the chemistry to do the chemical lysis of the particles to release nucleic acid. Right. Like I said, then we since we only started with swabs, there's not a dirty stuff there, then we can use single washes. So that way we can cut down the workflow and improve it's not just about the fast turnaround times. It depends on what instrument you use. You can get 9 to 12 minutes to finish 96 samples, or if you do smaller, lower throughput, you use smaller instrument, you do 32 samples at a time. But there is a lot. It's a lot of waste, right? So we also think about when you stock up a lot of solutions, the flammable, then you need a different capillary. So we also try to remove the flammable solutions to make it easy to use, easy to store. So it's more convenient for you to stock place, and also it's getting faster and much less, it's less prepared and less hands-on. It's always good. So another example is, like I said, I want to use similar solution so we can supply and make, we can to assure the supply. Also, you may stock fewer kits to do more things. So first, we may expand this COVID extraction to use the same reagent for the HPV detection, right? It's also virus. It's easy to break down. It's DNA, so we may use different elution conditions, right? So, since this DNA is easy to bind, we can even easily scale up to 400 microliter, use same reagents, so get higher detection sensitivities. So that's why we use the same reagent. We just change the protocols, and then we can get that it used for HPV genotyping. So the workflow is pretty fast with our newly launched HPV test. I think that the isolation, we just get the CE/IVD registered yesterday, I think it is. And it's another example is when we developed the sample prep for the MTB, right? The MTB it's a very difficult particle to break open, right? Most people use the bead beating, but it's difficult to do automation. Another alternative way is you do liquefaction with like DTT or DSAP or any other style compound with heating. And we saw the most convenient way should be the room temperature. So we figure out a way to liquidify the sputum to release to make it a liquid easy to prepare. Then during the same time, we also do the bacterial cell wall digestion. So that way, then we can do the nucleic acid purification. So this time, since it's used sputum, it's a lot of more dirty than the swab. So in this case, we'll add more washes to make sure the detection is sensitive enough. There's no inhibition going to the detection. So that way, then like a fit for purpose, when it's needed the highest purity, and when the starting material has more contaminant, we'll use more washes to get a cleaner solution. But the extraction still very fast. It's under half an hour. But the thing is, the key is we want minimize hands-on times. So that's what we call. So we make the purification just instrument time is longer, but the hands-on time is all the same. So here just summarize that. Then the kit's features, how it is. After we expand to the DNA virus, then we think it's good for use the same kits can be good for expand to other viral particles detection as well, like flu A/B and ISV that people use more to detect in the upper respiratory virus. We also think it's HPV just works fine. Any swab tabs or saliva samples for viral detection can use this kit. So that way, then you don't need to use a lot of different kits in the lab. And based on the same principle, we can use this the MTB, right? So it can be said it's suitable for more difficult sample types. It's dirtier sample types, as well as the gram-positive bacteria is difficult to break down. So we can use this case to deal with both bacterial and virus sample and dirty samples to do the nucleic acid purification. But this will use the same instrument. We use the same with same pre-filled plate. So on your user's hand, it's that the operation is almost the same for the purification part. It just like for the especially for the end is 350 or 360, then you just peel the film, serum film, and put it in instruments, all the same. So yeah, this I already talked about it. We can steal all this instrument, reagent when we design. We don't want to buy a new instrument. If you have an instrument already, the same instrument should be works just fine. So that's why we want the workflow as the platform-wise as simple as possible, so you can easily expand your testing manual. So here, just to give you an example how you use this workflow to do the upper respiratory virus. So we have we provided solutions from the sample collection to the sample accessioning and the extraction, then the detection. So if you use the full workflow, you get that. We can control the full customer experience of the whole workflow and seamlessly integrate every single step. And you can see there's two new instruments. You probably the Andis 3150. That's a much faster sample accessioning for the workstation, but we also have a 360 instrument. I'll talk later. Yeah, this one is this 360 because I heard that in Southeast Asia, most people use lower throughput. It's more convenient because they have more decentralized testing than not like in the U.S. Like 20% tests is sent to Quest Diagnostics, 20%, another 20% sent to a LabCorp. So all other labs, then other hundreds of different labs, and take the rest. So there is a very centralized. They usually do 96 or even 496 plates in parallel to do those tests. So for the lower, medium, low throughput throughput, we say, well, what we can improve, right? So for we call it the Andis 360, the instrument, we got a bigger screen. It's easy to look at what's going on, and also easy, most important, easy to programming. If you do have to change the program. And the standard program we have for whatever you need, your special way of sampling or whatever you need the slight modification, that's easy to change on the screen. And it's also got fast mixing and strong magnet. This is we want that one so it could be more efficient for viscous samples. This is critical for oncology samples like especially whole blood, plasma, a lot more viscous. And also like even saliva is more viscous. You need a very efficient mixing and collection to get it. And also it's have a flexibility to use large input. So liquid biopsy, for example, for NAPT, people use anywhere from 2 ml to 4 ml plasma. For cancer diagnostics, you use 4 ml. If screenings, most even go to up to 10 ml plasma. So this one we can, with our solution, you can go up to 5 ml plasma without spreading the samples in different well. And so it's much easier to use. And small elution volumes, right? That's going to improve our OD. I think it's very important because it can, if you, like I said, if every reaction, for example, you need 10 molecules, right? So if this 10 molecules you need 20 microliters, the template to get 10 molecules, then you may need to have like 40 microliter reaction. If I can reduce that elution volume down to half, then your molecular concentration doubles, then you only need 20 microliter reactions, so the cost goes down. That's why we want to smaller elution volumes. So this is just a more detailed list of this instrument. I think you can ask your local salesperson to get the details if you need it. Basically, all our current kit, we are do validation of this instrument and get the validate scripts, or you call it program for you to use. So it's you have minimal efforts to do validation in your own lab. We also developing like a lot of kits for, like I said at the beginning, we have two business units, right? One is infectious disease, one is for oncology side. So oncology side, we do before we had the DNA, you probably heard DNA extraction kits. We have also pre-filled. Now we also work on the FFP RNA and the sequential DNA RNA. So when you have limited tumor samples, especially if I need a biopsy, you don't have a lot of sample to use, so you don't waste any of those DNA or RNA. So we extract the DNA and RNA into different tubes from the same slices. You don't have to divide the slices into two sets, one for DNA, one for RNA. So that way, then you can get more sensitive testings. Now on the plasma side, we have safety in extraction. We also we notice a lot of the oncology side, when they draw blood, they use safety in it. They still want genetic background from the WBC, so we also have a new WBC DNA extraction kits coming out soon. The reason we also need a new WBC DNA extraction is because in the old days, people use whole blood DNA extraction for genotyping or whatever. They usually use just EDTA tubes, right, on the carbon, because the DNA is very stable and people don't, as EDTA is good enough to keep the white cells happy. But when people care about this cell-free DNA, then they need to stabilize the whole blood cells. They typically use a formalin-based or formalin-releasing agent to fix the white blood cells, so that the cell won't break to leak DNA to contaminate the cell-free DNA. So that fixed the cells, it's just like a FFP cells. It's difficult to break open. So we have to develop the different kits for more efficient of the DNA extraction from those safe DNA collection tubes. It just show you examples on how this performance. This is just I think this is a DNA kit, right? I cannot say the top title. I think it's FFP DNA kit. We compare Promega and QIAGEN. Really, QIAGEN is good for something, right? So Promega usually do a pretty good job on the DNA side. The company for the sample prep side is more start from DNA, and especially their first business is on the human identification side, try to compete with applied biosystems. That's how they get into the DNA extraction business. So they do a lot of good DNA extraction. So here that's why we compare also DNA, not the DNA with the Promega. The QIAGEN is good, but they use the filter-based. It's very difficult to automate, and they have a lot of QIAcube. Try to automate it, but at least in the U.S., I saw half of this QIAcube was actually sitting there collecting dust. It's not that efficient, and it takes a lot of time to load the tube in the swim bucket and flip the cap and fix the cap manually. That's a lot of work. The QIAsymphony is good, but the QIAsymphony is a huge instrument and throughput is pretty low. So a lot of people just use Kingfisher to do, and it's similar. We use the Andes 350 or the AutoPure 96 to do extraction. It's similar as the Kingfisher, the working principles. So we can do much faster, and so here we can see that we get the pretty consistent results and slightly better yield than the Promegas. Is the RNA and DNA kit. So you can say we can spread the RNA and DNA. So this is show a competitor, other competitor with columns, but this one we use magnetic beads. It's much more convenient for automation, and we can do a lot of faster. And with the same field, a single field plate, we can do 16 samples. If we use 350 or 360, and this 350 or and this 360, you can run two plates side by side, so you can do 32 samples at a time. It's very convenient to use. And we also understand some people, they just want to have much higher quality RNA from the FFP. Then we do short digestions to just release the RNA. So that way, then we can slightly shorten the workflow time than the sequential RNA and DNA extraction. I think there's some people start the early days, like the Genomic Health, right? That's the first company use a lot of FFP samples for cancer prognosis. I think at the beginning, they just do the breast cancer to say which patient will benefit from chemotherapy and which ones will not. So that stratifies the treatment. But most recently, most people just use the the DNA RNA for translocation, because the bioinformatics way is easier to do. But that one you don't need very high quality RNA. That's why most people use the sequential DNA RNA extraction for that. I think they told on most people, if they just wanted to use the RNA profile to as the markers for cancer prognosis, that's the way to go. And this is a, I saw this one is, sorry. Yeah, this is the one we use, the DNA, and we have, this one is still working in progress. I think this one we have the DNA from the white blood cells first, then we can use the leftover, use the circulating plasma for safe DNA. But then, like I said, this one, because the safe DNA collection tube, the white blood cell is cross-linked. So you see some old kids for EDTA blood tubes like this one. Down in the middle, right, you can see the DNA yield. For EDTA tube, all works fine. For the fixation tube, then you need the more digestion to get the good DNA out. This is I show a little bit on our preliminary data on the safety DNA side. This is done. We can be done on our new instrument, the 360, and we actually, as of yesterday, we just tested. We can further simplify the process to PD digestion, lysis binding, all on the instrument, and with walk away protocol. So the product will be more user friendly than QIAGEN or thermal kits. So this is just a summarize our existing kit and what sample types we match, and the certifications we got. Most of them we have the channel registration, and we're working on to get the CE-IVD tab. I think the first one is already CE-IVD, and second one is working, and the third one, I think we also almost done on the CE-IVD side. And this is another way of to dissect the based on the sample specimens and your target, whether it's infectious disease or the tumor or the oncology side. And I think for the precision medicine, we started doing the PGX and the CGX side. That's mostly from, I think this is blood is the one thing, but most people actually, for CGX, they've been used blood. For the PGX, most people are going to use just chick swabs or saliva. It's good enough for the genetic testing. And prenatal screening, yeah, definitely use safe DNA. And some high risk ones, they may go to the immunofluid. So this is just what I have today, and I'll be open for any questions.
Thank you, Dr. Fang, for the wonderful talk. Dr. Fang took us through the market, the nucleic acid extraction market, technology, and product design concept. as well as the product performance and the downstream application. So our next session will be Q&A. I will check the audience question. So, okay, one question from Noki from Thailand. So she's asking that sometimes the sample to detect TB is tissue. So whether 3D MAD will provide nucleic acid extraction for tissue extraction for TB.
Tissue, if it may need the pre-treatment, we usually for the fresh tissue, people what usually do is they just homogenize it and they take the supernatant is good enough to go forward with the current procedure to do detection. Some of people, if they want it depends on the pathogen titers. If there is very low, then they may even think about preferential lysis to get rid of human DNA first. So it's really, I haven't looked into how abundant the pathogens in the specific tissue. If it's very abundant, then some people use directly swap the tissue or just like homogenize and prefer and homogenize the tissue and get it out.
Mm-hmm. Yeah, so tissue, use tissue as an example usually happens for TB patient that exist extra long. So they often use tissue such as lymph node, or sometimes they use blood for as detection samples. Yeah, and usually for those kind of patient, the TB abundance in the tissue is quite abundant. Yeah.
Yeah.
Okay. That's all.
Yes. So that you may even use small amount samples. That's fine.
Yeah, right. Yeah. Okay, our next question still comes from Noki. Her question is that whether 3D MAD will provide to the market for a single sample extraction kit.
Sample extraction.
So the throughput will be one sample. Yeah.
Yeah, one sample. Yes, we can provide. Just the. It's you may want to use this extract. Just use them. We try to accommodate that side. Actually, it's both for low throughput and the high throughput, extreme high throughput. They want to do the aliquoting for themselves. So we have the bottle the kit, but I don't know whether this one we already have. That's in the plan. We started thinking all kits will provide the just for single use ones, so that way people can do it with magnetic stands instead of the instrument.
Okay, great. Okay, so we do have one question coming from Ken. So Ken's question is that what's the difference between Andes 350 and Andes 360? So in your talk, yeah, go on.
Yeah, so the two instruments, if obviously this called the LOTS, right? So it's got a bigger screen, but this is I think it's important for young generations. I think that's when I was leading the Kingfisher new instrument we call the AIPPAC, because they said the millennials, that means the people who born after 20 after 2000, right? So they're called millennials. They want the cool looking things, just like a. So that's why we make it look nicer and attract the younger generation. So that's one. So on the functional side, many major improvement. There's three things. One is you can do faster mixing and stronger magnet. So this too is important to get the extraction more consistent and fast from the viscous samples. Because viscous sample, if you don't have strong magnet, you need a very long bit collection time. And not just long collection time is not good. It's also when the collection time is too long, those beads first get on the tip cone, will get more compact, and then more compacted on the tip cone. Then it's difficult to break the beads apart to release nucleic acids. So if you stick too long, then it's very difficult to release. That's why you want to be able to quick collecting beads quickly so that the beads not get clumped at different times. Another sense, we want the same instrument. You also handle the large volumes, especially if the diagnostic lab to do both infectious disease and the liquid biopsy, like cancer testing. Nowadays, more labs doing both. So we want a single instrument can handle small volume and the large volume samples. So you don't want to change instrument. And you don't even change magnetic head, like the Kingfisher instrument, you have to change the head. With just different consumables, you different plates, you do different volumes.
Okay, great. Thank you, Dr. Fang. So we have time for one question. Okay. I see a question over here. So what is the advantage of 3D MAD extraction kit for blood sample?
Yeah, blood sample, like I said, this one is really, if you look at any blood sample, you need to ask the question is whether it's developed just for EDTA or citric, citrate anticoagulant, right, or the heparin. So it's really, this one is more suited for like preserved blood tubes, also works fine. So it's more versatile, especially like the for safe DNA. Some people at first they'll come out with extract cell-free DNA tube, right? Then a lot of copycats to use formalin-based collection tubes. When this wet blood cells is fixed, like this left corner figure in the center point, that's when it's the ETTA blood tube. Everybody works about the same. But if you use the fixed samples, then the yield the regular blood DNA extraction kits will get a very low yield, especially fixed for a longer time. So our kits can handle both preserved blood and the regular ETTA blood.
Okay, great. Okay, I think today, due to the time limitation, that will be all for today. Thank you again, Dr. Fang, for the wonderful talk. Thank you for your time. And thank you, guys, of the audience for your time today. So today's presentation also will be uploaded to 3D MAD YouTube account. So you can search 3D MAD on your on YouTube for other technology and products from 3D MAD as well. Thank you, guys, for your time. Thank you. Bye-bye.
All right. Thank you for your time.